version, a Tuesday version of Ocala Talks right here on WOCA, The Source. Joining me on the phone lines right now to talk about prostate cancer. It is Cancer Awareness Month. We're going to learn about the importance for early detection for this common cancer and available treatment options. Dr. Ian Thompson from the Texas Urology Group joins us. Doctor, good morning.
Hey, good morning. I really appreciate the opportunity to be here today in collaboration with Boston Scientific to discuss the importance of regular screening and early detection for prostate cancer.
Why should prostate cancer screening be a top priority for men or women? Anybody?
For men, it's the most common prostate cancer behind skin cancer in the United States. Approximately 250,000 men will be diagnosed in the United States this year alone. And for women, it's really important because, they help drive the conversations in our lives and sometimes get us to do some things that we may not want to, go talk to a doctor or go see a doctor. So they play an important role in this conversation.
Now, is this testing, is it, let me try to get it right in my mind. Is this something that can be done through blood work, or is this something that you have to sometimes be put under and get modules put in you to see what's going on?
Yeah, there are a lot of options, but the two primary ways we do screening in conjunction or together are a blood test where we look at what's called the PSA, and the other is what we call a digital rectal exam, which is an exam with the finger to feel the prostate through the rectum, and if we see abnormality on the PSA level being elevated or abnormality on the exam of the prostate, we will move on to do what's called a biopsy, which is a little more invasive, but where we actually take out tissue samples to look to see if there's actually prostate cancer causing those abnormalities.
What are the prognosis for a man if he's diagnosed early on, and what kind of treatment will he go through?
So if men are diagnosed early when the cancer is still just in the prostate, there's about a 100% survival rate 5 years from diagnosis. So it's really important to find it early. Treatment options for prostate cancer that's confined to the prostate include surgery, where we remove the prostate, radiation, where we treat and kill the cancer cells there in the prostate with radiation. And some men we diagnose with prostate cancer have a very low-grade cancer that we don't actually need to treat, and we can just watch it, and that's what we call active surveillance.
So what are some of the side effects, though, of those treatments you just discussed?
So side effects for surgery can include leakage of urine or incontinence, sometimes erectile dysfunction. When the prostate cancer is treated with radiation, it can cause some urinary symptoms afterwards. It can also cause sometimes long-lasting effects to the rectum and some to the bowel. So those are the most common side effects that we see with those treatment options.
Well, let's talk for a minute then about space or hydrogel. Why is it important for patients undergoing radiation to be aware of this product?
So space or hydrogel is a newer tool that we have in our toolbox, which really helps us reduce the side effects of radiation treatment of the prostate cancer, those effects to the rectum that sit very close to the prostate. And space or hydrogel is a minimally invasive procedure that we can do most times in the clinic, sometimes in the operating room, that with a small needle, we're able to inject this hydrogel in that small space between the prostate and the rectum and create a larger space and kind of a cushion, if you will. So that gives additional distance and really significantly reduces the effects of the radiation to the rectum itself. And the space or procedure may take 20 minutes, and patients can go on with their normal activities later that day and the next day. And this hydrogel is actually reabsorbed by the body within 6 months. So once the radiation treatment is done, shortly thereafter, all the hydrogel will be reabsorbed by the body itself.
Prostate cancer, I know if you catch it early, it's very treatable, and it with a 100% survival rate 5 years after diagnosis. Why is it, though, that prostate cancer is so important to catch early as well? Is it one of those cancers that can spread very easily if left undetected?
They can. Normally, across the board, prostate cancer tends to be a slow-growing cancer. But sometimes, if not detected early, it can spread. And then you don't have the treatment options that we're talking about now, such as surgery, radiation, don't really exist once it's spread outside the prostate. So you move more on to treatment with medications, sometimes chemotherapy. And so that's really the importance for that. And normally prostate cancer doesn't cause symptoms until it spreads. And so when you feel symptoms, it's because it spread somewhere else many of the times. And so that's why we talk about screening. And as we're coming out of this pandemic and trying to get back to normal, really having those conversations with your doctors about checking the boxes and doing the regular screening that you should be doing. And for prostate cancer, that can often be a blood test, usually it's a blood test, and an exam of the prostate.
Talking with Dr. Ian Thompson from Texas Urology Group about the importance of early detection for prostate cancer. Doctor, there's age groups associated with different tests and all. Is there an age group? Is there a bell tower for what age we should start doing this? Is this something we should do from 40 years old on, 45 years, 50 years? Is there an age requirement,
Yeah.
or is it something everybody should look at?
Well, so men between the guidelines say that men between the ages of 55 and 69 get the highest value of screening for prostate cancer annually, blood test, exam. For those men, and so it's individualized, and so it's a discussion with a doctor, but the men that have a history of prostate cancer in their family, sometimes if they have, we know that family history of breast cancer or ovarian cancer, we know some of the genes associated with those can affect a man's risk of prostate cancer. So in those situations, or you can start screening at younger ages down to maybe 45. There's really no value in screening for those men that are younger than 40 years of age, but it's really a conversation of when to start screening and a shared decision-making model with your physician.
Doctor, where can people go find out more information about places or situations for screening? Where can they go on the web, or where can they go to find more information about this issue?
Yes. So just general prostate cancer information, American Cancer Society, cancer.org, or the American Urologic Association. Additionally, if you want to learn some more information about the SpaceOAR technology that we talked about earlier, spaceoar.com, SPACEOAR.com. A lot of resources there as well. And it's just really important for people to just have the conversation, especially this month being Prostate Cancer Awareness Month.
Dr. Ian Thompson, thanks so much for taking time out with us today to talk about this important issue.
Hey, great. Thanks for the opportunity. Have a great day.
It's something that we all need to, I'm at that age now where I get my PSA tested every year, and it's something you have to do. Birthdays today, real quick. Birthdays today. I got them here somewhere. I know I got them somewhere. Calm down. They're right here. Here they are. TV and film producer Jerry Bruckheimer is 78. Stephen King, 74. Funny man Bill Murray is 71. Ethan Coen of the Coen brothers is 64. Dave Coulier from Full House is 62. And Rob Morrow from Numbers and Northern Exposure, he's 59 today. Want to thank all my guests and all my callers, Carol Ann Baldwin, Matt Gibbs, all my callers, all my interviews, and, of course, all the listeners. Without you, this show would not be possible. We'll be back tomorrow with the election results. That's right. Go vote, folks. It is election day here in the city of Ocala. Go do your civic duty and vote. We'll be back same time tomorrow right here on WOCA, The Source.
Broadcasting from the Ocala International Airport, this is WOCA AM, W242CA FM, Ocala, 1370 AM, 96.3 FM, The Source.
USA Radio News with Lance Pry.
A group of more than 24